Welcome to the JEMS Report. This is the first episode in a long-standing podcast for the Journal of Emergency Medical Services, brought to you by Clearing Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee. I am the editor-in-chief of JEMS Magazine, along with Jeff Frankel, the managing editor of the magazine. We will be bringing hot topics, news, and interviews with authors and contributors for the JEMS magazine. Today we have a very special inaugural version of this with Dr. Sarah Fabiano, who is our new medical director. Dr. Edward Dickinson was the medical director of JEMS for the past 30 years, and he has moved on to focus on his program with the University of Pennsylvania. So we're very happy to have Dr. Fabiano, and welcome to the JEMS Report.
Thank you. Yeah, it's a big shoes to fill after somebody's been in them for 30 years, but I'm excited. So thank you for the welcome.
Yes. So just to bring everybody up to speed with you coming on board over the last few months, you're new to us and you're probably new to some of the public. So can you give us a little bit of your background?
Sure. I've been down in South Carolina now for 13 years, and it'll be 14 years this year, actually. I practice emergency medicine full time in the Greenville, South Carolina area. I'm an EMS physician, board certified EMS physician, so I'm over a bunch of different EMS agencies here. My passion really is EMS and education, and so I have my own podcast series. I certainly have lectured in it, and I trained in Rochester, New York, and I'm from Buffalo, New York originally, and that's mainly my background. My med school is in Syracuse.
Awesome. So what made you go into emergency medicine?
Probably undiagnosed ADHD, but realistically speaking, just loved the variety, loved the interaction with the people, loved the ever-changing environment. So that's why I did it.
And you mentioned that you also work with a variety of other EMS services other than your hospital service.
Yep.
Can you tell us a little bit about them?
Yeah, I'm doing actually a bunch of different ones. I just completed doing an EMS, paramedic EMT programs at a college. Just finished being medical director there. I just finished being medical director at a correctional facility. I'm doing several ground, one that's just doing transportation, the other one that is our county 911 system. I'm the assistant medical control there. I have 2 helicopter services under me. I do some wildfire EMS medical control. So I've just a bunch of different variety. It's been great.
It sounds like you're kind of all over the place. Why the importance in EMS? What drew you to pre-hospital medicine?
Oh, I love the story, right? Like I love to have like people tell me the story, like they're the eyes and ears when they first get there. And so they have all this critical information that a lot of the time is lost in translation. So I really love that. And I feel like I get along with and can educate and discuss things and cases with EMS like with ease. I just feel like I tend to jive with them better. So I've really kind of taken ownership of that. I'm also love to be available for people. Like I'm on call a lot, but I'm also, people also call me for all kinds of advice or questions, which I don't mind. And then it's just really been rewarding as far as that goes.
Sounds like you're a true educator at heart. So why do you feel EMS is important to the United States or to your community? I mean, obviously, you mentioned that you have various services that you're working for, so each one impacts their community a little bit differently.
Yeah, oh, it's so true. But I mean, I think that, and I don't even want to bring up the word COVID. Honestly, I'm tired of it. But to be truthful, we saw such a transition during that time where people were like, oh yeah, you could do all these other things. And we're like, we've been saying it. But vaccinations, testing, treating patients in their home, community paramedicine became huge then, telehealth visits, being able to do more procedures, having them work in the emergency department, having them work in hospitals. I mean, it's amazing. I'm also over Clemson Fire and EMS, and we stepped up our game this year with the treatment at the football stadium, and that's amazing. And that's a whole different can of worms. But I mean, EMS just is so, they're the first people that are on the scene of these sometimes chaotic, crazy scenes, and they have to parse through what's important, what's not important, and really diagnose or stabilize at least in a very short amount of time. It's really amazing, remarkable.
So being, part of the EMS family, I'm sure that you had heard of JEMS prior to coming on board.
Yes, of course. I mean, who hadn't heard of JEMS? It was, were super exciting. And then, of course, they, they're now with FDIC for their conference, which is I think is only going to be better now that we can have things in person again.
So what is your thoughts on the importance of JEMS and kind of the impact that it can have on the EMS community in general?
Well, I mean, I think we're always looking for, that research or that study or that better way to do things or other ideas. And I mean, you need a place where that can kind of, you can kind of have all of those in one spot. Certainly, I think JEMS attacks it from that standpoint as far as, articles that are submitted, the podcasts, the events and training that they do. I mean, I think it's the best of all worlds. They certainly have a social media platform, which, of course, everybody needs that nowadays. And I think, you get people energized, you get people to the point where they're like, hey, I read this on JEMS, or I got this idea on JEMS, or look at, they talk about doing this in that state and it worked better there. Maybe we can try it here. And I mean, I think, EMS in general is so broken up. It just is. I mean, we're in all these different states and there's different counties and municipalities have different things, and fire does some things and doesn't do it in other places. And it's just, even in one state, it's overwhelming. So I think if you have one place where most people can kind of come together and discuss things or, trade ideas and information, it's key.
You did a great job at selling the brand across everything that we do, our social media and our events. What do you think your role is going to be, and what would you like to accomplish as you step into the medical director role?
First just like to, I of course like to get the lay of the land. I've read several article submissions already. I've got a new one, I guess. I think he emailed me yesterday, but those are fascinating because sometimes you're reading them and you're like, wow, this is really interesting. And then of course, the social media stuff and the interaction with the boots on the ground is really key for me. At the podcast that I do locally, we have like a place where you can submit cases, submit ideas, and be personable. And I never want to be that person, even as a physician, certainly not, that is unapproachable. So I'm hoping that through JEMS, we can get this on a larger platform where we can interact with people. People feel like they can trade ideas and stuff. We can have, these, real-time kind of case reviews and interesting podcasts and MacGyver tricks that people come up with and all kinds of stuff that people do. I think is really interesting. Or what if there's a problem with something, or we find a solution with something? I mean, that's all stuff that I think we can really embrace. Plus, the conferences. I mean, I'm like, I want to see kind of where that goes in the next couple of years, like as people are coming out of their shell from this pandemic and such. But like, how can we make this like the best conference ever? Like, what is the draw for people to come to that conference? Is it the training? Is it the hands-on stuff? Do they want more simulation? Do they, that kind of stuff? So I'm excited to see where that goes.
Yes, GEMS at FDIC for 24 will be coming in April. To your point, we will have GEMS Innovation Summit, which will be leaders from various types of EMS services coming together to talk about, like you mentioned, all the things that they're going through, and maybe somebody can come up with, hey, that might work in our jurisdiction. It worked in California or it worked in Florida. Maybe we can do it here. Lots of hands-on stuff. We will have the GEMS clinical competition where teams will be competing in scenarios, and then hands-on and of course booths. So GEMS at FDIC has been expanding since the COVID experience, and our footprint in 24 will be double what it was in 23, and truly trying to nail down the medical component. And it doesn't matter where you come from, whether it's fire-based, hospital-based, community-based, private agencies, flight, wilderness medicine, disaster medicine. It's all part of our mission here at GEMS. And that's also one of the things that we're working towards, kind of revamping the brand a little bit to be open towards all things pre-hospital, because to your point, some of the best ideas come from kind of unknown sources, and we're like, hey, it works there. It could very much work here.
Right. Or, even just having to navigate the political environment that EMS and fire is. I mean, it just is in different places for a multitude of reasons. And getting advice from other people. How did you overcome that? What was your approach to this? That kind of thing. A collaborative effort, I think, is the best way to do that. So.
And you've really kind of hit the nail on the head with kind of this collaboration and what we're hoping GEMS will become again, as we move towards the future, kind of a sounding board and an area for, all things pre-hospital to discuss and to see. And there might be some differing opinions or things that worked here but wouldn't work somewhere else. But until we really have those discussions, like you mentioned, COVID changed the landscape. Things that we weren't doing before, we're doing now. Things that we didn't think were possible, or things that, we were standing in the middle of the square screaming at the top of our lungs saying, we can do this, and nobody would allow us to do this. Suddenly we can. We've become that critical niche to help service our communities.
Yeah, it's really gonna be remarkable. And then you gotta, of course, tackle things that are, controversial, right? Like there's a movement to get rid of AEMTs, like they just think that, you should just finish and become the paramedic. So, hearing the pluses and minuses of those sorts of things. There's a movement to make, there's certainly discussions and support to have, EMS be an actual degree, a bachelor's level degree or a master's level degree. And then, seeing where EMS can take you, of course, there's an EMS on call right there. They literally don't care.
The job never ends.
That never ends. It's literally on do not disturb and it still rings. So I'm not even sure how that happened. But, the other thing is, you look at those controversial things like, or things where like, you find somebody else's career and you're like, well, how did you even get here? And they were like started as a paramedic or started as an EMT or a firefighter, that kind of, and that's really super interesting because you always like to see like, how did somebody get to that point? Maybe that's what you want to do, or vice versa. So I think that's interesting.
Yeah, it definitely shapes a lot of careers. And from an EMS standpoint, it definitely helps when you have physicians or nurses or radiologists or somebody that's in the healthcare field, who kind of cut their teeth on pre-hospital medicine and kind of remembers, oh, I remember what that was like. I remember bringing in patients like that. It gives a very different view for healthcare as a whole when they've had that pre-hospital experience.
Right. Exactly.
Well, I don't want to take up too much of your time. Obviously, people are calling you, they need you.
Yeah, it's a never-ending job, but that's what you do. You do it because you love it. So.
Yep. So I very much appreciate your time, and just like to welcome you to the team. We will be working very closely together, and we were looking forward to your input and your support as JEMS moves towards the future.
Awesome. Thank you so much, Ted. I appreciate it.
Thank you very much.